Life is complex, so is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness. Hello everyone and welcome to another episode of Humanizing Mental Health. I'm Trent Nickers.
And I'm Jeremy Alcorn.
Well, I'm wondering, Jer, how are you feeling today?
That is a little bit of a loaded question, isn't it?
Yeah. Because, most of the time, we think about that when we're following social convention. Most of the time, do people really want to know how you're feeling?
Mm-hmm, absolutely. A lot of times, actually, that statement is simply a greeting. How you doing? Okay.
Yeah, but, like in our profession, how you feeling is, we try to get a bit more depth. And for you, I think because of like some of the experiences that you've had going on in your life, that can open up a real Pandora's box.
For sure. Yeah, absolutely. To give context, I am 46 years old, and from the time that I was 38 years old, I have been in constant neck and back pain.
Wow. So almost a decade.
Yeah, so it started in June, so it has been just over 8 years. Mm-hmm.
Yeah. So, you've talked to me a lot about this on or off mic, I should say. I was going to say off camera, but we're not on camera today. But can you give our listeners just sort of like an understanding of like what pain means to you?
Wow, that's a big question. Pain is a very fascinating and odd thing. So some context, one of the things that, or I've said before, I work on the military base half of my time, and I was in the physio department, and in the physio department, there's these pictures of a scene from Harry Potter.
Mm-hmm.
And it's a scene where Dumbledore and Harry are talking, and Harry asks, he says, "Is this real, or is just this all in my head?" And Dumbledore says, "Of course it's in your head. Why would that make it any less real?"
Mm-hmm.
And actually pain is a lot like that. That is to say, we often look for very specific physical causes, and sometimes that happens. Sometimes you don't. Like you do an MRI, you do a CAT scan, all of those things, X-ray. I've had many, many tests, and at times there's been something that they went, "Oh, I think we know what's wrong." But if they treat that, or even when they have tested later, done another MRI, they go, "Oh, that actually healed." So, that can't be the cause of your problem. And I think there's a lot of people out there in the world that don't have answers for why they're in pain, and they get told this is all in your head. Mm-hmm. And now that's not a very helpful statement. Whereas what I saw in the physio room was something slightly different. Mm. It's a statement around, even if we don't find some other, what someone would be able to identify as a real cause, of course it's still real. Our nervous system continues to send a pain signal, and sometimes that's one of the hardest things to actually try and treat.
Yeah, absolutely. And that makes me think about, basically what we're talking about is we're talking about chronic pain. And one of the ways to actually treat chronic pain, like you and I have talked about this before off mic, like what they talk about is they talk about pain reprocessing therapy, which basically it's almost like cognitive behavioral therapy for pain. What it is that it looks at the pain matrix within the brain and how that over time can become very sensitized to different things. And while what you're experiencing within your brain is absolutely real to you because those parts of your brain are lighting off, it's what it really comes down to is it's about teaching your brain about when it's reacting to things that have a physical cause and when it does not, or when it is not. if that makes sense. So
Yeah.
what you basically look for is you look for exceptions to when you may not feel pain. For example, the book that I read about this, where it's actually the founder of it, called I believe it's called The Way Out. We can probably link to the book within the show notes. He talked about the fact that he had extremely bad back pain all the time, like where he would become, he called himself a chair expert because he would know exactly what chairs, like just by looking at them, would cause him pain and what chairs wouldn't, like where he was like literally picking out office furniture with people and like would, like just be able to go through things. And he talked about when he went to a baseball game, he was fully prepared for sitting in the seats and like just being in agony the entire time. But because he was so invested in the game and really enjoyed it, he said that that was one of the first times that he, for I think for many, many years, didn't experience chronic pain. And that was the exception to the rule.
Yeah, isn't that curious? In fact, like the reason that we picked this particular title is because you facilitate a group by that same title. Can you speak to that a little bit?
Yeah. So a conversation with pain, like, and really what it is because we all will go. Because for myself, like I come at things from an internal family systems perspective, and the idea is that with a conversation with pain, we're not trying to deny pain, we're not trying to push it away, but rather what we're trying to do is we're trying to figure out, okay, what's going on for us? What are we experiencing? How can we really understand what pain is trying to tell us? And not only that, but how does the pain then influence how we interact with ourselves and how we also interact with other people, like friends and family?
Yeah, for sure. In fact, on that note, maybe I would speak a little bit to my own experience.
Sure.
So I think that there's more than one aspect, as there typically is, in terms of my own experience of how that pain developed. One is that I was way too critical of my physical body, that I needed to look a particular way. And so I got into exercise really heavy, and when was enough? I just couldn't stop. I kept pushing to the point that on a chest day, there are days that I would then do 10 sets of 50 push-ups. So I do like 500 push-ups on a chest day.
Holy moly.
And I felt so proud of myself, and I felt so good, and I would look in the mirror, and what I saw was what I wanted, and the only way to keep that was to continue to push hard. And it wasn't healthy. It wasn't kind. It wasn't compassionate to myself.
Mm-hmm.
I was only good enough if.
Yeah.
And so that was part of it. In terms of that physical aspect, I went sledding with my son, in the Great White North.
Welcome to Canada, eh?
Take off.
Hoser.
And so we were going down this hill, and we had this sled that had skis on it and a wheel that you could turn a middle front ski.
Oh, yeah.
And so I was standing on the back, which was unwise. And we went down, and he took a sharp turn, and I went flying. Yeah, hoo, hoo, hoo.
Thank you, Goofy.
and there wasn't a ton of snow on the ground. It was really icy and not much snow. And for those of you that live in parts of the world where you don't experience, negative 30 degrees Celsius, the ground gets very hard.
Oh, yeah. It's like getting hit by concrete.
Yeah. And so I landed on my right shoulder and the side of my head, and I felt something injure at that point. And but I got up, and I moved my arm around, and I had full range of motion. I was like, So I didn't get checked out by the doctor. And I was like, okay, I'll lay off a little bit to give myself some time. And so I laid off exercise for a week, but then I just jumped right back in to really hard exercise. And I would never give myself a chance to recover until finally everything just bound up and my body just said no.
Yeah.
That's part of it. The other part is I was working in a clinic for public health, and the overwhelming intensity of trying to deal with the amount of problems individuals I've mentioned before in a podcast that was titled From the Inside, a Therapist's Experience with the Mental Health System. The people would come out of the psychiatric unit from being very dangerously suicidal, and they wouldn't get an appointment for a month, and then I didn't have time for them, and again for a month, and I couldn't let them wait. So I was stacking on extra people, and there was a time in which I was just seeing people through my lunch hour, and I had 6 weeks where I didn't even take a lunch break. And all of that intensity sitting on my nervous system, taking on other people's pain. And I didn't even mean to say it that way, but it's true.
Yeah, because we talk about the fact that emotional pain can have like an allostatic load, and and there again too, it can even represent somatically. So you're taking on all of this like vicarious pain, and I'm almost wondering like your nervous system then would almost become super sensitized to everything because like you've gone way beyond your window of tolerance.
Yeah, for sure. Like the pain receptors don't know the difference between physical pain and emotional pain. Mm-hmm. It's a very fascinating combination between physical causes and cognitive, or what some people might call psychological effects.
Yeah, and I mean, we can even see that more, like that can even be represented even more with children, for example, because a lot of them don't have the verbal lexicon to express their emotions. So a lot of times that will come out when, they'll express it physically. Like, for example, if they're experiencing anxiety, like a lot of times they'll talk about stomach pains and different things like that.
Yeah, absolutely. Totally. And the number of times that I've seen a soldier and they tell a story such as there was an IED blew up, and a person took shrapnel, but they're wearing armor. Mm-hmm. And the perceived position that, I look at myself, my limbs are intact, I don't see myself anywhere bleeding. And so they go, my right shoulder feels a little strange, but I'm fine. And they continued their function in that moment operationally to ensure that they were safe and their colleagues, their people, that their fellow soldiers. And then when they have this moment to examine themselves and they look at their shoulder, and shrapnel had actually entered into their shoulder, and as soon as they saw the puncture, the blood, mm-hmm. Then all of a sudden, boom, their arm just went limp, dead, couldn't move it.
Yeah, absolutely.
But it functioned before their eyes perceived the injury.
Mm-hmm. Mm-hmm. Yeah, but right there too, I think like what you're really speaking about is you're speaking about disassociation.
Yeah, it is actually curious. Were they dissociated from the injury? Maybe. And that could be a piece of it for sure.
Yeah, because like as you were talking, like two things stood out to me. Like the whole idea of the conversation that you and I, or that you talked about the other day, like where you were talking to a soldier and you said, "Were you injured?" And he said, "No." And then you said, "Well,
are you sure you were injured?
Are you sure you were injured?" And then the other thing too, I almost think about like with Peter Levine, where you're working with soldiers, mm-hmm. and then their body, like when it comes to trauma, that they will go through and they will react things because our certain their body will go through certain repetitive movements because they need to go through and they need to complete the trauma response.
Oh, sure. Yeah, for sure.
Sorry, I mean, I really stumbled through that. But
No, that makes total sense. In fact, there's another piece that I wonder about as well, and that is how much cognitive ignorance there was to the injury. Mm-hmm. And when the cognition caught up that this injury had occurred, that all of a sudden the brain function changes and then the arm goes dead. Use a couple of examples. Mm-hmm. But first you were going to say something, so go ahead.
Yeah, well, I want to preface this by saying, like, what I think is really going on there is that this is a survival response that basically the body was under threat until and until they were really safe, that's when the body recognized, okay, I'm safe, I'm secure. Now I don't need to engage that limb because
Sure.
it can now be repaired. And it's almost like going back to that one quote from Predator, where with Jesse Ventura, where he's like, you're bleeding, and he's like, I ain't got time to bleed.
Right. Yeah. Yeah. That does connect well. In fact, the notion of cognitive ignorance may be more appropriate in a couple of other examples. One being a person recently was telling me about just playing around as a kid, and they're playing some night game, kick the can or something. It's fairly dark outside. And he was running, and he knew that this fence, which was a barbed wire fence, it was going to be there. He knew where it was. He thought it had 3 lines of barbed wire, but it actually had 4. So he slid to zip under it, and the barbed wire caught him in the forehead, but he didn't actually even recognize it. So he was running, and he's like, why am I so sweaty? Man, what's dripping down from my head? Why am I so sweaty? Until he got inside. And then he saw in a mirror the blood, and then all of a sudden pain hit. And so sometimes there's like literally a cognitive ignorance, and our psychological function of that cognition, its awareness, actually becomes critical in the pain process. This, as I understand, becomes part of a pain feedback loop.
Oh, absolutely. I mean, well, and that again too feeds into the pain matrix of the brain. I don't have that one as well memorized as some other neural pathways, but yeah, it really comes down to with the pain matrix of the brain. Like when the body recognizes something, gets a certain stimuli, it will release something within the brain in order for you then to basically be able to remedy the situation. So it's all about utilizing your senses.
Yeah.
Does that make sense?
Yeah. So, and the other example is individuals, say, that were at war and they lost a portion of a limb, so they lost a hand.
Phantom limb syndrome.
Yeah. And then they're like, man, my hand is really itchy. No, your hand's not there. Or actually, my hand hurts really badly. And of course, you're aware of this, but for the listener, one of the strategies that they would do is that they would have a box that had a mirror in it. They would put the stump in one side and their other hand in the other, and the mirror would make it look like the hand that was missing is there. And immediately, pain, itchiness, gone.
Yeah, well, and I mean, yeah, like even using the mirror, scratching that hand or whatever. For those of you that need an example of what that would look like, if you've ever seen The Amazing Spider-Man, the first one, with Andrew Garfield, Reese Fiennes plays the lizard, or Dr. Kirk Connors, who has one hand, and there's actually one scene where he actually uses that technique for more of a dramatic effect, but that's similar to what is actually going on.
Yeah, for sure. And so for people out there that are experiencing pain and that they're chasing the cure, I'm not telling you to stop or to give up hope. At the same time, there's a variety of different both cognitive, behavioral, emotional processes that can help. I remember myself trying to chase the cure. I'd seen multiple massage therapists, chiropractors, doctors, specialists, spent thousands of dollars on private different strategies, Graston technique, and all of these things may have been helpful for other people, but at the end of a Graston session, I just looked like a ball of hamburger, and it never made any difference. And so I remember I went to one massage therapist, and as they were doing their massage and they're kind of doing a assessment, and they're going, I don't see anything structurally wrong here. And then he started to give me this a dialogue about how the brain is everything. This is a brain thing. And it was very, very funny because he didn't know who he was talking to, right? And I said, well, actually, your guts make more serotonin than your brain does. Way more. Way more. And your heart is sending more signals to your brain than your brain is to your heart. If I could have thought through this, then I would have done that a long time ago. I'm actually looking for a somatic release because this is a somatic problem.
Yeah. And well, that's the thing is that you though you can't just tell people, it's all in your head, because really what that is that that's just completely invalidating where they're
Mm-hmm.
coming from.
Sure.
Because actually it was really interesting when we tried running the chronic pain group for the first time. I remember we had a local speaker named Trevor Moore. Have you ever met Trevor?
That name is very familiar, but
Yeah,
no.
yeah, he's quite well known around medicine, and like he's basically a golf pro, and like he lived with chronic pain for years and years and years, and he said that they tried everything to figure out what the source was, and basically it was like 6 years, and they finally found, and I may be not telling this perfectly, but they found like a small nodule on the bottom of one of his feet that was sending all of these pain signals
Mm.
that would have easily been overlooked.
Sure.
And and he talked about how that impacted his entire life. It almost ended his career. It impacted his ability to communicate with his family, to where the point where he talked about where they were almost doing the mental health continuum with him, like every day, like where are you at in your mental health continuum, to know how, like, if he has an ability to react, like, are you in red, or he would use like from 1 to 10, like, are you a 10, are you a 7, or are you an 8, because the pain was so bad.
Yeah, for sure. There was a long time that I felt like I was just in a like pain coma. I would sit in an appointment having a very difficult time doing anything but thinking about how much pain that I was in and trying to give the person in front of me this my full attention. And eventually I realized I just can't do this. I went to a doctor in Calgary who looked at things, because a doctor in medicine hat said, oh, the only thing that's going to fix this is a surgery in your neck.
Mm.
But the surgeon then, when I talked to him, went, there isn't actually a target for me to fix here. Like, at your age, this particular finding is normal. Do 1,000 tests on people, and you're going to find maybe 30 or 40 or maybe even 100, maybe 10% of the people are going to have these kinds of findings. And like almost all of them won't have any symptoms. And so then I was driving home and I was like, I can't live like this anymore. And so I went to my family doctor and I got a medical note to be off. And I was actually off for 5 months, and I spent like 3 hours at least a day doing physiotherapy activities and things to try to get myself better. And while those activities were helpful, I still was in a very high level of pain. And so I'm not giving medical advice, because every specific person is different, and I'm a social worker. I'm not a doctor. So being very clear.
Thank you, Bones.
I'm a doctor, not a bricklayer. Yeah. So, but I can tell you my journey led me to a place of realizing that Western medicine has its place, and that other healing methods have their place too. So for me, part of it was finding out what kind of movements actually are a problem for me, and being able to go, what kind of exercises are the right ones? And physio could only take me so far, because they're not sitting inside my head knowing how it feels. And so I found a device called the Iron Neck that...
Oh, yeah, your helmet.
Yeah, you place on your head, and it has this elastic thing that straps to a door, and it allows you to get both strengthening but also mobility movements. And then I also had some Reiki treatments from the Reiki master that's been on our show, Annie Anderson. And there are some devices that use specific energy. It's a weird way of saying wavelength of heat and radiation.
Are you talking about the wand?
So there's a wand. I can't remember what the wand is called. There's also a device that uses the same technology that actually you use with your feet, and I could feel that. It's funny you say the person you were talking about that was a pro golfer. I could feel from my feet in this device, it moved all the way up through my shoulders.
Yeah. I remember you treated me with the wand one time at my house.
Yeah.
And like I have just because of the fact of my cerebral palsy. I have very shallow hip joints, and I
Mm-hmm.
get hip pain quite a bit.
Mm-hmm.
And I said that was the first time in a long time where my hip didn't hurt.
Right? Amazing. And there's that piece of things. Also, my own processes of meditation and spirituality, setting some limits in life. In going, I had to change my job. I couldn't stay in that environment anymore. This is one of the biggest reasons why I left.
Yeah, so as I hear you talk, I hear that, like, if we were to really look at this was a real wake up call for you to, rather than pushing your body, but to really engage with your body, engage in the conversation,
Yeah.
not only with the pain, but with your body, and saying, okay, what do you need from me? And how can I give you what you need so I can continue on with my life?
And actually coming from a place of compassionately working with my body. In fact, I'm in a place in which I'm just okay with who I am and how I look. I don't need to change that. But that's really important. And I'm also listen to a variety of different people just from a place of curiosity and what I'm willing to engage with. So I had historically had treatment with an old tricyclic antidepressant. It's called amitriptyline. But the doctor didn't follow up with me right. So he prescribed this, and he didn't tell me, you need to come back because we're going to need to move this. I'll start you on 10 milligrams, but really the therapeutic dose for this is at least 25, maybe up to 70.
Wow.
And so then years later, like 4 years later, then I finally had talked with another doctor and understood that, the way that this is supposed to work is it takes weeks and months for this particular medication to alter or rewire your nervous system, that ingrained pain signal that keeps firing and firing and firing, for it to turn off that pain signal or to adjust that pain signal.
Yeah, and almost dial it down to a more average level, so where it's not turned off, but it's not over interpreting things that it may be experiencing.
Yeah, exactly. And this same medicine functions very well for preventative treatment for migraines. So because it's neuralgic pain.
Yeah, like that makes me think of like fibromyalgia, basically.
Which would be another pain condition that's really actually not well understood.
No, and like as I hear you talk, Jared, like the one thing, like I'm just even though you've talked a lot about this with me, I'm still shocked at the level of advocacy that it really takes for things like this to move forward, and how resilient an individual would need to be in order to go through this journey of pain. And I really imagine that for some people it would almost be exhausting, where am I going to keep trying potential solution after solution, or at one point am I just going to say, forget this, I'll just live where I'm at?
Yeah, or choose to die.
Yeah, or choose to die.
Yeah, for sure. Absolutely. I used to hurt from TMJ all the way through sciatic, and I'm not there anymore. Other things that became a part of this were more, I guess, naturopathic kind of. I'm not sure I even said that right, but using things such as arnica, which is a pain and inflammation reducer, and using it topically, and some other things that help with that. And so today, I feel like there's a spot just below my shoulder blades that runs all the way into my chest. But actually, for the most part, I feel okay. And my mood isn't taken over. My life is no longer just a matter of trying to get from one moment to the next through pain.
Yeah, and also, too, like to just kind of cap it off and to bring it back a few, what was it, a week ago or a few days ago, you started working out again.
Yeah, for sure. In a very different way. And part of that has been discovering what movements hurt. I know now that I just can't do push-ups. That won't work. Even 10 push-ups the next day I'll hurt. So then I just listen to my body and go, that's not something I can do.
Yeah. And you know what? And if you work with him, well, I've worked with kinesiologists for a long time. They always say, there's always like 5 or 6 different ways to activate those muscles.
For sure. And I found that likely I just need my back to be a little stronger, and back movements for exercise, they don't hurt. Low weight, higher repetition, just trying to get that body used to moving, and the shoulders going back to where they should be, as I did so much chest before that it just curled me forward.
Oh, absolutely. Yeah, because you're really tightening, though I don't think they're extensory muscles, but they're just the ones, like, even for myself, like, as having cerebral palsy, I'm more prone to be curled in. So what I do whenever I work out with my kinesiologist is we do the exact opposite of those movements,
right,
to like stretch and strengthen those other muscles so that the body really is in balance.
Better balance. Yeah, for sure.
Yeah.
In fact, I think of the two of us, actually, you probably have a more long-standing relationship with pain than what I have.
Well, yeah, like I've had pain over my whole life, basically, and it's due to my cerebral palsy, because with me, because I have high spasticity and different things, that my muscles are constantly tight or tightening, and I have to do, and I physiotherapy regularly in order to keep them loose. And if I don't, and I don't do as much physiotherapy as I honestly should, or as I did when I was a child, but if I don't stretch and I don't strengthen, or if I do jump, I'll feel it throughout my entire body. So even though I may joke that I turn a horror movie into a comedy by just watching it with people, sometimes like that can be a painful experience, because for me to jump even with a doorbell, every single muscle in my body will tighten up all at once like that.
Sure. And of course you have also a combination of medical interventions and also the physiotherapy and other things that you do as well.
Yeah. So like I go to the gym at least 2 to 3 times a week. Right now it's twice. This week I only made it once. I do physiotherapy, hopefully, 1 to 2 times a week, and then I also have a baclofen pump on board. And now what I mean by on board, for those of you that don't know what baclofen is, it's basically a muscle relaxant. And for most people, the method of introducing this medicine into your body is usually through oral method, but what I have is I have it introduced intrathecally into my spinal fluid. Now what I mean by intrathecally is that I literally have a pump implanted into my body, and then I have a catheter that is directly connected into my spine, and it introduces it into my spinal fluid. And the reason for that is that normally whenever we ingest most medications, it tends to pass the blood-brain barrier, and for things like muscle relaxants, that can have a significant cognitive effect. But if you're introducing it directly into the spinal fluid, less of that actually goes into your brain. So even though I'm on a very high dose, I don't have as much cognitive effects, and more of it goes directly to the muscles themselves.
Which means that you maintain your level of alertness rather than having that cognitive dulling, a sedation effect.
Yeah. And I mean, you at one point even tried baclofen yourself through the oral application.
Yeah, there's a whole bunch of stuff I use. Baclofen, I could see why you have it as a pump, because it just made me horribly sick. It was terrible.
Oh yeah, like honestly, for just for context for individuals, I get what they call a simple continuous dose, which basically means I'm on a regular dose every hour on the hour, and it's so concentrated to the point where it's literal micrograms per hour. And but the issue with that also is too, like if you ever go, like where I've actually, when I was younger, I had my spinal column actually grew over and into the catheter itself, and actually blocked off the catheter. So I actually ended up going through through underdose, which actually ended up causing my body to start to seize.
Yeah, that would have been horrible.
Yeah, that was, and that was really interesting because we were here at the Medicine Hospital, and nobody really, they'd never heard of a baclofen pump before, because I think like I was maybe one of two people in the city, if not the only one that ever had it. So they thought that I was basically a drug addict.
Oh, sheesh.
Yeah, and I mean, I'm not meaning to judge them. I think that they probably followed their procedure properly, but no, I ended up having to get oral baclofen and then go back up to the hospital in Calgary, and they ended up having to rectify the situation. But yeah, for every intervention that you do, there's always some benefit, and there's always some risk too as well.
For sure.
Yeah,
that totally makes sense. Well, I feel like we really kind of pulled everything together.
Yeah, the only other thing that I don't know if it would even be warranted, but I would really be interested to see like a family perspective in terms of, like, if we were to bring Amy on or somebody else, to see like how they've experienced, your journey with pain.
Yeah, I think at times I was not fun to live with. Like, that's an understatement.
Yeah.
Like being overwhelmed by pain, and some of the interventions that I tried to be able to move through that, it is certainly something I'm not proud of how I conducted myself through those years of trying to find my way through this.
Yeah, absolutely. And I really want to say what I took away from today's conversation was really how, like, that, like, I've seen you go through this whole process, but I've never thought about the resiliency that you've had to really exhibit going through intervention after intervention, almost being like that dogged detective.
Oh yeah, I guess there's actually one more thing that I would say to listeners that might experience something similar to this, and that is, if you don't have something that is physically obvious, like someone can't see you with a cane, or they don't see you limp, they don't see the pain, then it's very isolating, because people think you're normal and you're not, and they have all these expectations of what you can do, and actually you can't, and they don't understand when you say, "I'm sorry, I can't help you move." Or I can't do this, or I can't do that, and that is something that where people really begin to not only suffer, but they suffer in the context of how they feel other people view them, because they don't feel like they have an excuse.
Yeah, like my disability, my condition is visible. Yours is not. Like, just to look at you, you would look like, your average 46-year-old man, but you've always talked about the fact that you had like that invisible goblin or whatever, like you felt that was trying to rip your head off.
Oh yeah. Wake up in the morning, man, feels like a giant tried to rip my head off last night.
Well, yeah, and I could only imagine, like, sometimes, like, you would have those intense looks on your face, and because you let me know what was going on, I was like, that's Jeremy just in pain. But for other people, you may look like you're pissed off or something of that nature, and that has nothing to do with them. That has everything to do with the giant trying to rip your head off.
Yeah, for sure. I think that's a quite a great place to wind up, isn't it?
I think so.
So on that note, I'm Jeremy Alcorn.
I'm Trent Akers. See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.